So the next one is shrugs with weights. So you're gonna hold, I got my 100-pound weights here. You're gonna shrug up, right? So I'll show you from this angle. So what you wanna avoid, like we've been talking about all those other ones, the rounded shoulder position, right? We don't like this. So when you're doing the shrugs, you're gonna give a nice big retraction and just lift the shoulder blade. So it's a retracted, elevated scap, all right? You can see there's an asterisk next to this exercise because it causes a lot of shear in your lower cervical spine, upper thoracic spine, so not indicated for patients with cervical, right? And so we wanna also make sure they're not looking like this when they're doing it, right? And this is another one where you see people in the gym, they get there and they're cranking and they're using their whole body, right? This should be, if we're doing this exercise, really for that, just for that posture, right? Someone who might have a depressed scapula, you're gonna push it back, give it a little lift, that's about it, right? We're not going all the way up, we're not trying to overdo it, we're not throwing a ton of weight on this exercise. All right, the next one is the body blade here, right? So the way you can use the body blade is you get it started and then you try to resist it. So what some people do is they'll have you wind it up and then just try to hold it. So you'll do a bunch of these where you try to wind it up and hold it without smacking yourself in the face, right? And that's like a stabilization exercise. The way I like to do is with some motion. So the 3 movements I gave you here is body blade IR, right? So you're trying to get that moving in this GHJ, IR, position and stabilizing the scap, stabilizing the posture as you're doing it. The next one is in the scaption plane, so you're getting it moving while you're going up in the scaption. Same thing, not letting your shoulder hike, right? Not looking like this when they're trying to do it. Nice posture and working on the scapular stabilization in this plane. And then we'll see in a second the D2 pattern going up, starting from here, and then you gotta change the angle, right? So as I'm going through, I'm changing the angle that I'm using the bandwidth much harder than the rest. That's gonna be a real tough deltoid exercise when you get to that level. All right, our difference between dynamic hug and serratus fly, right? So there's different ways to do the dynamic hug. You can do your dynamic hug, which is gonna activate your serratus here at the wall station. Same thing like we talked about with the chest fly, right? So with the chest fly, you're standing still and just moving the arms in the horizontal adduction. Now we wanna incorporate that scapular protraction with the horizontal adduction. Scapular protraction, horizontal adduction, right? Make sure that they're not going into kyphosis, right? That this is scapular protraction and not thoracic kyphosis, right? So you should see their chest kind of cave in, not collapse down, right? So sternum should stay up the whole time. Get that scapular protraction. This will be a dynamic hug. If you don't have the wall station, you're giving it at home as a home exercise. Just make sure they wrap that band underneath the shoulder blades, right? If they wrap it above the shoulder blades, it'll eventually roll up on them. So just have them tuck it under and then bring it forward. Scapular protraction. All right, the difference between that and a serratus fly, same thing like we talked about with the press, or is a fly. There's a fly motion, right? So they're gonna hold those shoulder blades back into a retracted position, and then retract. And they're gonna protract and adduct. Retract, abduct. Protract, adduct, right? So they're doing those 2 motions that they're isolating the scapular motion with the shoulder motion. The dynamic hug is all at once, and it's mainly just that concentric motion. With the serratus fly, we're getting a lot of concentric, eccentric going on. More motor control. All right, so the serratus scoop with the foam roller. One of my favorite exercises here. Similar to that wall slide exercise, So now we get that serrated, we get a nice serratus component. So you're gonna start with the arms at the wrist. You're gonna get some tension on the band. If they're not able, you can start without the band. You're gonna have them push into the wall, actively push. The same thing, chest up, right? I wanna see the push with their spine moving, push, and then scoop it up. And then you see the difference between this and the slide is when I get here, the reason why I call it the scoop is you're gonna scoop it up, right? So you wanna get that thoracic extension as you're going up. So you're pushing into the wall and scooping up through the spine, right? So you're maintaining that scapular protraction into the foam roller as you're going up, okay? Difference than the wall slide, standing still and just sliding up. Foam roller. Foam roller, you're gonna go with the scoop. Staggered stance. Your serratus punch is gonna be on the floor. That's the most common position, a good place to start. Right, so that's your scapular protraction, retraction. Protraction, retraction. Okay, well, again, same thing. You wanna make sure they're not doing, their head shouldn't lift off the table, and it shouldn't be a kyphosis where you're seeing their whole spine come up, right? It's just protraction, retraction, and you wanna make sure they retract. So it's not just up and down and going through half the motion. They should retract, protract, retract, protract, okay? So it's a good way to start, and then you could do the same thing from your wall station or with the band behind, like the dynamic hug, and do your protraction, retraction. So this is still a serratus punch, but in standing. And then one of my favorite exercises, one of my favorite ways to give, this is also gonna work your upper trap. This is the way we like to work the upper traps. Protraction, retraction. So it's a combination of protraction and elevation, and retraction and depression, right? So that's when you wanna see that scapular elevation. We're working your upper traps with this one. This is the way your upper traps should work, right? So someone with a naturally depressed scap, we want to do those instead of those shrug exercises. This will be your exercise of choice. All right, so then your serratus push-up version, right? So that's the open kinetic chain version, doing it as serratus punch. You could also do it as serratus push-up. So our progression for the serratus push-up, so it's the same exercise, right? So this exercise, serratus push-up, I should be able to do with my elbows extended, and my elbows should never flex. It's not a push-up. Right, we're just doing the scapular protraction, retraction. All right, and you're looking for all those same things. We're not collapsing, pushing out, right? We're not letting the head go forward, right? They can have nice scap motion, but then they drop their head, or they drop their pelvis, or they're just pushing their butt up and back, right? So you want just the protraction, retraction. Right, so we're gonna start at the wall, or you could do it as a full push-up plus. Push-up plus. Push-up plus. Okay? So I start at the wall, then they can do that same exercise in quadruped. They can do it as a plank position, push-up position, on a wobble board. This is our wobble board. So their wobble board version will be here. Retraction, protraction, retraction, protraction, right? Now going to a full push-up, unless you're doing a push-up plus. On the Bosu or stability ball. Okay. So this is our serratus punch, right? Our push-up plus. Goes all the way into the push-up and then all the way back up into the plus. Okay, so you can do it there. You can do it with the feet on the Bosu. Well, so the easier version would be from the knees, and then from the toes. Okay. All right. And that would be the same idea with the stability ball. So we skip the plank version. Alright, so you can do it with the arms. Right? Doing that protraction, retraction. Right? Or you can do it with the feet on the ball. Protraction, retraction. Looking for all those same things. So they're not sagging. It's not butt all the way up in the air. And that they have nice set scap. Not letting them roll forward probably like I was there. Shoulder circles with the weights. Yeah, shoulder circle with a weight is gonna be with a weight plate right here. Okay. So our shoulder circle with the weight, so this is gonna be like a deltoid exercise, a nice shoulder warm up. Okay, so the closer you stay to your head, the easier the exercise. The further away you go, the harder it is. So you're gonna go clockwise. So your sets and reps will be something like 10 clockwise, 10 counterclockwise. All right, and maybe give 3 sets of that. Wall circle on the wall. This is another stability exercise. Scapular stability exercise, right? So I'm holding here, I'm gonna protract, I'm gonna push into the wall, and then I'm gonna roll the ball. Okay? And same thing, you're gonna do clockwise, counterclockwise. Those mistake patients make all the time. Therapists will even demonstrate it like this. The shoulder blades all moving. They're changing their weight shift. They're moving their lumbar spine, right? This will be a stability exercise. You push, nothing moves but your GHJ into that like adduction, flexion, abduction, extension. Adduction, flexion, abduction, extension. Just rolling the ball just from your GHJ. Right, so we don't want to see this posture. We don't want to see rolling the ball. And then just rolling the ball. Right? We want to see that good push and going around. And you're going to do that same progression the same way we did the progression I just showed you with the serratus. So they can do that on the wall. They can do it in quadruped, in a plank position. They can put their feet on a wobble board, right? Or their feet on the Bosu. So a good way to do the wobble board. Because getting your feet on is a little challenging, so you just have the knees there. And then the same thing, so they're gonna do that set. Here, I'll turn a little so you can see the posture a little better. Right? So set their cervical spine, set their thoracic spine, set their scapula. I'm actively pushing into the ball, right? Not just weight bearing, I wanna push into the wall, activate serratus, and then roll. Okay? So you can do that with your feet on the wobble board, feet on the ball, physio ball, or on the Bosu. All right, now we have our PNF patterns. It's not a PNF class, so we're just going to use them as an upper extremity functional exercise. You can do them with a TheraBand or with a weight. If you're doing with a TheraBand, it'll look like so, where you're standing on the band and then moving the arm. And if you want to move it one way or the other, you're just going to use the band to stand on. I like to do these exercises with weights because that's more or less how you use the motions, is holding something, not necessarily in the movement with a band. So your D1 flexion is flexion, adduction, external rotation. Right? External rotation is like this, so it kind of goes with supination, and then down to your extension, abduction, IR. So your D1 pattern, going from this position up is D1 flexion, going down is D1 extension, D1 flexion, D1 extension. Your D2 pattern is D2 extension, D2 flexion is up here. So this is what we call the waiter position. So you're going up to a waiter position, and then you're going down to put the sword into your sheath. D2 extension, D2 flexion, D2 extension. Okay, so you can do those with TheraBand, like I said, standing and or for the flexion components, and then you can do them here for your extension components. Here, the D2, and let's see, I'll show you with this arm, going this way for D1. All right, make sure you get that shoulder and forearm rotation. Those are resisted PNF patterns. We went through the various ways you can do a push-up on the wall. We're looking for those same things, right? That we look with the serratus. No collapsing, no forward hip posture. It's not just coming from their pelvis, right? So we want the hands going to the chest, going through the same closed chain progression. Shoulder taps is the same exercise, except tapping. I'll show you here in quadruped. This is a great weight bearing exercise. You're just gonna tap your other shoulder. That's why I call it a shoulder tap exercise. Make sure they're not collapsing, keeping that nice flat back posture, including the cervical spine. All right, physio ball roll up the wall is a good range of motion exercise for someone with just doing their range of motion, trying to work on their flexion, range of motion. If you add a little lean, then we're working some stability, and then you can have them lift it off over their head. So a nice progression of exercises is getting them just in the range of motion. Then maybe a couple weeks later, you're gonna do the range of motion, and then a little lean, a little overpressure that they have to stabilize. And then a couple weeks after that, you're gonna have them go in, stabilize, and then lift off. Come back down. It's a good way to get a nice little progression going of the same exercise. All right, scapular depressor. So you can do this exercise as a purely scap exercise where you sling your arm through. So it goes just on the scap, right? So I have it just here. So you don't want to be straight on because my shoulder's a little forward. Most people's are. So you're gonna have them tilt just a little bit to the side of the band, and they're gonna do scapular depression, basically scapular depression, retraction here. And I call this a closed chain version because basically just the scap moving on the thorax, nothing else moves. All right, so technically probably open chain, so that's how I label it. You can do it also right below, so it's kind of like a modified version of a dip. So again, scaps back. So you want them in a little bit of that shoulder extension. I'll show you from this angle. Right, so when they're pushing down, they're a little bit of shoulder extension. We don't want to see this where they're feeding into their forward shoulder, right? We want that retract depression, right? And not letting them body collapse, head going forward. Chest stays up, head straight. Scapular depression, straight down with TheraBand. All right, and then we're gonna do it from the chair in a dip position. So you can do a few different variations. Whenever you do this type of exercise in the chair, you want to make sure the chair is stabilized for safety. You don't have them do this exercise in the middle of the floor, the middle of the room. Make sure the chair is on the back, so if it tips, it'll lean right into the wall. So you can do your dips here from the chair, so they can use their hands to assist. Most people in general can't do a free associated dip, especially in this position. So this requires a lot of scapular retraction, shoulder extension, right? So we don't want to see the dip looking like this. Again, feeding into that forward head thoracic kyphosis, rounded shoulder, elevated scap position, right? So it's a great exercise to get someone out of all these positions. You naturally start here, and then you gotta peel back, chest up, head back, right? The exercise should look like this, right? We're really working on that posture. Okay, and then they could, you know, walk their feet out, get a little bit more, walk their feet out, use a little bit more of your arms, right? Go all the way to 1 foot, right? And progress up that way. Right, your plank progression is gonna be all the same, right? So you're starting with your plank position with a tap, plank position with a weight shift, right? Doing your plank with your arms on the Bosu. So you would do if you're doing just a plank, what we call a low plank, you'd have to use this side of the ball. If you want to do a high plank, again, focusing on that shoulder blade position, you can do it here. And then a difficult scapular exercise, it's also a good core and hip exercise, but a difficult scapular exercise, right? Because you can see I'm going into that same position we've been talking about this whole time. Elevated scap, rounded shoulder, forward head posture, thoracic kyphosis, right? So a side plank is a great exercise to get someone out of that posture, right? So instead of collapsing here, going into our nice posture and trying to hold that posture. So you're gonna get a lot of good serratus activation here, right? And then you can have them do it like a half side plank, into a full side plank, into a high plank. Right? Focusing on that shoulder blade posture. All right, so I'm gonna skip the TRX and we're gonna go down to the physio ball planks. So there's some different positions here, some different movements. So first one is the ABCs. So you can go through the same progressions, doing it in a quadruped, doing it in full plank position, okay? If you got the Bosu or you're using just the ball here in a controlled environment, if you have someone guarding you, you can do it like a high plank. So I'll show you from the quadruped. So ABCs is you're just gonna be in this plank position. Again, see how I can stay in this position all day, right? That's not the goal, right? So they gotta get there. You gotta get there. Hips down, set shoulder blades, chin regular, like in neutral, and then they're gonna do ABCs. Right, write out the whole ABCs. See how many they can get in a row before they need to take a break. There's your ABCs. Circles, same thing, just going in circles, clockwise, counterclockwise. Next one is a saw, just going forward and back. Good, that's it for that one. And then farmer's walk is like we talked about with the shrugs. You gotta keep those scapular retraction, depression, right? And working on your forearm strength, just walking back and forth. You're gonna give this exercise for time, how long they can hold that position, increasing the weight. That's hands at the side, and then in the 90-90 position. So same thing, coming out of this posture, going into our nice scapular depression, retraction posture, right? And have them do it at 90-90.